Hello, I am here by the names of Kevin Shimge from Class B, Level 3. I am going to talk about first six questions from Applied Immunology. First question are what are immunocomplex and what is their role in immunoresponse? Firstly, immunocomplex are formed when antibody bind to its specific antigen. It has three roles where the first one are immunocomplexes the body defense against pathogen by blocking pathogenic pathogenic ability to infect host cell. The second one is ozonization through enhancing ability of phagocyte to inglyfy and destroy pathogen. Activation of complementary system. Here we found that there is triggering a cascade that aids in pathogen elimination. The second question states that how does complementary activation interact with immunocomplex? As we have seen that immunocomplex are formed when antibody binds to its specific antigen. Here we are going to see how does complementary activation interact with it. As when complementary system is activated, it leads to three steps where the first step is inflammation. During inflammation there is production of pro-inflammatory molecules. The second one is ozonization and phagocytosis, where during ozonization and phagocytosis there is ingryphy of pathogen. The third is lysis of pathogen or lysis of the cell. The lysis of pathogen by C5b9 membrane attack complex. We go with third question. Third question asks as says that what mechanism helps clear immunocomplex from this circulation. Immunocomplex are removed through mononuclear phagocyte system. We are here have three mechanisms. Where the first one is complementary tagging, where C3b binds immunocomplex and helps in signing for removal. The second one is transport via erythrocyte, where complementary attack attached to red blood cell and are called on red blood cell to liver and spina for clearance. The third is phagocytosis. During phagocytosis, we have two cells where there is macrophage and neutrophil that inglyfy and degrade immunocomplex. Effectively, clearance prevent their decomposition and associated inflammation. Here we go with the fourth question that states that how does immunocomplex contribute to autoimmune disease? Immunocomplex can contribute to autoimmune disease by causing inflammation and tissue damage when they deposit in tissue and activate the complementary system. During this question that stated that how does immunocomplex contribute to autoimmune disease helps us all to know about type 3 hypersensitivity. Here there is some systems that are used where the first one or that leads to inflammation. Immunocomplex can activate complementary system which recruit cells like neutrophil to affect tissue. This can lead to inflammation, tissue damage. Immunocomplex can deposit in tissue, particularly in kidney, and cause tissue damage. Here we go with the fifth question that stated what is the role of regulatory T cells in immunoregulation. Firstly, regulatory T cells that are called triggers are a subset of T cells that primarily or that plays a central role in maintaining immunohomeostasis, where we have two functions where the first function is suspect activation of other immune cells and the second is select anti-inflammatory cytokinesis as you see it on this diagram. Here we go with the last question where state that how does the central tolerance prevent autoimmune disease? The process of eliminating self-reactive immunocells during their development in primary lymph node organisms. This means that central tolerance is well lymphocyte cell. There is lymphocytes development into lymphoid organism where we have T and B cells, where T cells is development. Each mature development is in tumors, where B is for is in bone marrow. Here we go with two mechanisms, where the first one is negative selection, and the second is the receptor editing. We have during last question we have sub A and sub B, where the sub A is what is autoimmunity. Autoimmunity is when the body does are confused through distinguishing self from non-self, or occurs when body's immune system mistakenly attack its own health cells, tissue, or organism. Here we go on sub B, where it said that eliminate 12 main medical important autoimmune disease, their causes and clinical manifestation. Here we go by the first one. The first one is systematic lupus erythematosus, where its cause is genetic predisposition and environmental factor, where its clinical manifestation is fatigue, joint pain, swelling, butterfly shared rash across the chest and noise. Here we go with the second. The second is severe disease, that where that its cause is genetic factors and its clinical manifestations: diarrhea, weight loss, abdominal pain, bloating, fatigue, and malabsorption either, and the skin rash. The third is autoimmune hepatitis, where the cause is genetic predisposition, environmental triggers, and fatigue, where its clinical manifestation: fatigue, jaundice, abdominal discomfort, where the fourth is myasthenia gravis or grave disease, where its cause is autoantibody. Its clinical manifestation is muscle weakness, sweating and speaking, and respiratory difficulty in severe cases. Where there is another disease called Sengenal syndrome, where its cause is genetic factor viral infection, and its clinical manifestation is dry eyes, dry mouth, and difficult in swallowing. Here we go with the other disease that's called vascularity, where its cause is clinical factors, infectious, drug exposure, and environmental factors, where its clinical manifestation is generalized syndromes like fever, weight loss and fatigue, skin rash, and sinusitis, hemoptysis, where it's Bradley cough, and renal failure. Here there is addition for disease. There is type 1 diabetes mellitus, that where it's cause it can be it is genetically factor, where it is clinical manifestation be body weakness, joint pain. Thank you. Here comes the reference that I referred on during searching for answers for that question, and thank you.